We'll be getting started in just a few minutes. Thank you so much.
I still see just 5 participants.
Okay, welcome everyone. We're going to go ahead and get started. This webinar will be recorded and on our fallspreventiontexas.org website for others to view at a later date if needed. But at this time, we'll go ahead and get started in the interest of time. And Marcia, you want to take it away?
Yes, thank you so much. First of all, this is the 3rd day in a series. All week. We are so pleased that this year we are having Fall Prevention Awareness Week with webinars around the noon hour every single day. Let me thank our sponsors. First, the Center for Population Health and Aging. We've been helping to host this, but in collaboration with the Texas Active for Life Coalition, T4A, Texas Healthy at Home, and then Texas Health and Human Services, as well as Unite Us. So the theme today is going to be keeping steady in Texas. Today's speaker, I'll be starting off moderating. I am the founding director of our Center for Population Health and Aging, and also a professor here in the School of Public Health. I've been interested in falls since the 1980s when I was at the National Institute on Aging. So I'm so pleased to see the continued attention to falls. The co-director of our center, Matthew Lee Smith, is probably the person in Texas who's done the most research on falls, whether we're looking at falls at the local level, the state level, or the national level. And then Ashley Wilson, who's also been on all this week, she's the assistant director and has worked with us on our statewide projects around falls. And then somebody who's behind the scenes, but we want to acknowledge, is Lauren Jenkins, who is our marketing manager and who's helped us with the placemat and also setting up our website. But let me just stop and ask Lauren this question. Do we see any other attendees trying to get in? It looks as though we just have 2. Lauren?
Ooh, sorry, take myself off on mute. Amy and Melissa are the 2 that we have right now.
Excellent. So just so we only have 2, can Amy and Melissa write in the chat where they are from? It was always nice to know who we're talking with. So let's go to the next slide, please, Matthew. If you've been on all week, you know how pleased we are to have a governor's proclamation. This is really giving vital attention to falls prevention throughout the state. You can find the proclamation on our website. Here's the link. And we read it the first day. We're not going to read it again, other than to say we're so pleased that the governor has recognized the importance of falls prevention. Let's go to the next slide, please. Ashley?
Sure. So each year after Falls Prevention Awareness Day or Week, the National Council on Aging sends out a survey to the states across the nation to fill out the activities and events that each state conducted or participated in during Falls Prevention Awareness Day or Week, or really the whole month of September as a whole. So a member from the Texas Falls Prevention Coalition has always completed that survey, but this year we were proactive and decided we were going to send out a survey for Texas on our own first to see if we could gather some information from around the state. So you'll see on this first bullet, there's 2 ways you can access this survey. The first one is on our new fallspreventiontexas.org website. You can go there under resources and take the survey. Or there's also the direct link here. It's a Qualtrics survey that you can click on to take the survey. So we're encouraging everyone on these phone calls to take it and to also share this survey with any partners or colleagues you have who are also interested in falls prevention and working on falls prevention activities the next few weeks. So far, we've had 24 responses from the survey. Different organizations such as AAA's, Meals on Wheels, some academic partners, community centers, senior living, and corporate partners have all filled this out, indicating that they're doing activities during Fall Prevention Awareness Week. And we're really happy to have such a wide array of partners fill this survey out. And then here, this item, or the list on the right, are some items that people have said that they're doing this week. Most frequently, people are providing presentations, lectures, or webinars to older adults and caregivers. They're distributing information. Some are participating in health fairs, either virtual or in person, conducting falls risk screening events, etc. So you can go to the next slide, Lauren. The other thing the survey does is that we asked this year for people to input any information on events they were having in their area. We would just like to highlight the people that did put some events in. And that was the Brookdale Senior Living in Tarrant County, the Brazos Valley Area Agency on Aging, and the Area Agency Aging on East Texas. They had reported some events they had going on this week and this month. And if you take this survey and your events have already been completed, that's fine. We'll take those events from the past, and we'd still love to report those to NCOA when we fill out the survey for Texas at the end of the month. Next slide, Lauren. I think it's back to Marcia.
Well, let me come back on, but thank you, Amy and Melissa, for telling us where you're located. It seems like both of you are in healthcare systems, and I think the study is very valuable for people in healthcare. But I'm probably not telling you anything you don't already know about how falls has been and remains a public health issue. And here are just some of the most recent statistics that we have, and you can look at them. But what I think is important is to think about the determinants of falls risk. So it's the intrinsic aspects, the more biological, clinical, and that's one of the reasons we're going to be talking about STEADI today, but it's also behavioral and environmental. And at the very end, we'll link you to some environmental references also. So let's go to the next page, please. During this week, it's important to think about the call to action, what we do on Falls Prevention Day, what we do on the Falls Prevention Week, but also what we do all year long. And so if we just think of the community-wide efforts are needed, this is really a health and all, a falls prevention and all strategy. So the first is making sure that everyone is aware that falls are preventable. They're not an inevitable aspect of growing older. This is why we're so pleased to have the governor's proclamation. We're also pleased that there is now an inventory of evidence-based community programs. The most popular in the Aging Services Network is A Matter of Balance, but there are many more. And it's good to see that there are also, I guess, an OT on the call today, which is why we think it's so important to integrate falls prevention into clinical care. So it can't just happen in the community. It has to happen in both the community and clinical, and really all settings. It's important to think about how we can take advantage of new technologies. There are now a whole plethora of falls sort of alert systems, as well as technologies to actually monitor and even be able to predict those who are at risk of falling. We showed you the data, the most up-to-date data on the numbers of falls, but I think it's important that we keep our surveillance systems up so we know about falls, we know about injuries, we know about cost. And then the last is, it's important to think of practice and research, but it's also important to think about the policies we need to prevent and manage falls. So it's policies that might be in hospitals or in home health care settings. Let's go to the next slide, please. Matthew, can you please talk about the STEADI Toolkit?
Would love to. Thank you so much. And I really appreciate that overview, Marcia. So it's wonderful to have everybody here. I think that most are familiar with what STEADI is and maybe its various elements, but I think what we're going to do is just give a high-level introduction to it, why it was created, its core essence and its components, but then really try to talk a little bit about each of those elements. Why do we ask the questions? How do we kick off the process? And then talk about how it's been used in various settings, medical, clinical, community and otherwise. So the STEADI, the Stopping Elderly Accidents, Deaths, and Injuries Toolkit, and see that T there usually is what tricks people. It's STEADI. And really what it is a process. It is a process based on an algorithm to identify risk for falling through self-reported and physical functioning assessments, to then go ahead and identify risk levels and kick off a process so that these individuals can go to professionals, evidence-based programs, and other types of screenings and follow-ups so that they can better manage their falls and their fall-related risks. Marcia and I were so fortunate, and Ashley, to be involved in the STEADI Toolkit and its dissemination right from the beginning. So working with Dr. Judy Stevens and Elizabeth Phelan, who really developed the toolkit with the CDC, we were able to work with them to better understand how this toolkit should be disseminated, packaged. And you can see now today there's online trainings and all these other courses that we can talk about as well. The core essence of the toolkit were based on the American Geriatric Society and the British Geriatric Society practice guidelines. And those are the best practices, but really it contains a very wide collection of materials that are for a lot of audiences, whether it be for the providers, for the older adults themselves, whether it be checklists, whether it be for the community-based organizations, just tons and tons of information. So with that said, here's the algorithm. And the algorithm is the core of the toolkit. And typically this was created to start off in clinical settings. However, it has evolved since then. They've really attempted to create more of a no wrong door approach so that anybody can kick off the process. Now, certainly some of these aspects in the algorithm can only be done in clinical settings or by individuals who are trained to do so, like some of the functional performance testing or gait and balance assessments or any kinds of eyes or feet type of assessments. But with that said, you can see from the start, we look for self-reported information. We look to identify falls risk right at the top in that green box. Is this person at risk? And that's where we're really going to focus a lot of our efforts today, is talking about that Stay Independent brochure and identifying risk and why it's so important to identify risk. But knowing this information kicks off the rest of the process. to really truly understand how it is that we manage their needs and make sure that they can protect themselves through a variety of different types of tailored interventions based on their risk level. So on the STEADI website, there are a way large number of resources, and it's somewhat overwhelming. So identify them, download them. It's wonderful to have them all. The one, again, that we're going to focus on is that Stay Independent brochure. But at the same time, there's also these resource guides, and these are for clinicians. So the tip sheets, they have case studies so that you can learn more and kind of do some internal role play to understand risk and assessment and what the needs are. They have charts and pocket guides, but it's not just for the clinicians and the allied health professionals. It's also the resources for the patients. So they have a series of brochures about various different topics about environment and postural hypotension, their medications, the interactions they have with healthcare providers and others. And they even have exercise handouts. So you can see from the timed up and go, the chair rise, the 4-stage balance test, all these physical functioning assessments so that you can better understand those assessments, but understand what kinds of physical activities the older adults can engage in so that they can strengthen those core muscles. Because we really think about lower limb strength, flexibility, and balance. Lots of checklists and then referral forms as well, because even though we identify the risk of the older adult, we want to connect them. We want to link them to other services in the community or other specialists and clinicians. So that way we now have an ability to refer and be able to share the information we've learned from the older adult and make sure that that continuity of care can be upheld. And then of course, all the continuing education. And I believe somebody who is attending said that they have not yet done this online training, where there are continuing education units available. And it just helps to reintroduce these concepts, understand the algorithm, and it's really great. I don't think it's necessary to implement the STEADI, but it certainly does help. And with that said, the core essence, I think I referenced in the algorithm, what kicks off the process is understanding risk. And if we don't understand risk, we don't really know what to do next. So the Stay Independent brochure is a phenomenal resource. It's being used not only in clinical, but also community settings, a lot of varieties of settings. But what it really does is not only ask these questions to identify risk of falling, but it also kind of describes a little bit about why those items are important, which we're going to go into more depth about here next. This was developed by a dear friend and colleague, Dr. Larry Rubenstein, and this is something that is a validated assessment. If you score 4 or more out of 14 points on these 12 items, you're deemed to be at risk. So it kicks off a process. It goes back to that algorithm, and now you can start doing some physical functioning assessments, et cetera, and kick off an entire process. And so with that said, the NCOA, National Council on Aging, has also called this the falls free checklist. So it's kind of multiple names, but the same thing, same core essence. So the NCOA has this on their website as part of their falls free package, but also the CDC has this as part of their Stay Independent brochure. But at this time, I'm going to go ahead and really highly, before I pass it over to Ashley, say the toolkit itself, because it was created in a clinical setting, oftentimes people believe that's the only place it should exist. But there have been a large number of efforts to try to translate this to be able to use, especially the Stay Independent brochure, in a variety of different settings. And with that, there are so many. So we think about nurses, we think about physicians, geriatricians, but what about the physical therapists, the occupational therapists, the PAs, the MAs, all of these other individuals who can be trained to create a system, a culture of falls prevention in that practice. We've even trained the office administrators and some of the front desk reception individuals so that they can learn more, so that it's everybody learning together that we can identify falls, we can prevent falls. But it goes beyond that. The area agencies on aging have started to use this. The ADRCs have started to use this. There have been many different efforts in university settings. We've had nursing schools, we've had OT and PT, we've had public health students use this in health fairs and other types of ways to start creating this so that they can identify risk, understand what's prevalent, what's happening in their communities, and then how to synergize partnerships. And then there's also been a huge push in pharmacy. Pharmacy is one of the disciplines that has adopted the STEADI outside of the initial clinical settings the most. So with many of the different pharmacies and many of the different chains, they have been doing a lot of training so that these individuals, especially when you think about medication management and the potential postural hypotension and other issues, they've started to now say, oh, well, why don't we do this assessment at the same time as we're giving out medications? This is a place that older adults commonly go. So again, a great way of synergizing so much that's happening around this toolkit. And it really just took this toolkit to kick off that process to start getting so many different disciplines, professionals, and settings interested in the topic. So that's one of the reasons we want to highlight it. But at the same time, when thinking about the checklist, I'm going to turn it over to Ashley so she can talk more about it.
Sure, thank you, Matthew. So you're seeing here again a picture of the Stay Independent brochure and the checklist. And like Matthew said, the National Council on Aging has their version as well, which is they call the Falls Free Checkup. And that one's actually online. So if you go to ncoa.org and type in Falls Free Checkup, you can do the online version. And we've used this in our setting, of course, in our evidence-based programs and our falls prevention programs out in the community as well. And when it's not done in the clinical setting, we always say that, of course, these checklists are not substituted for medical care and always check with a medical professional, but we're using them as an assessment tool. So I wanted to go through these for you. And we actually are going to go through them not in the numerical order that they're listed on this checklist, but this group of panelists together, we kind of grouped them in different categories. So they're going to be a little bit out of order, but we realized that this checklist is really good because it goes into all the different ways that different areas that can be a risk for falls. So we're going to talk about, you can go to the next slide, Lauren. The first one we're going to talk about is the risk, physical risk and mobility risk, some factors for that and why those are important. Then we're going to talk about medication side effects risks, as well as mental and emotional risks. They're a little bit out of order, but we've grouped them like this kind of to make sense of them. So if you look at this, you're going through the checklist. The first statement here is, I have fallen in the past 6 months. If you check yes for this item, you're going to get 2 out of your allotted 4 points here. And this is important because people who have fallen once are likely to fall again. The second item on this list is, I use or have been advised to use a cane or a walker to get around safely. Again, this gets you 2 points if you answer yes to this question. And that's because people who have been advised to use a cane or a walker may already be prone to falls or more likely to fall if they're already using a cane or a walker. So those are the 2 questions that get the 2 points if you answer, being a little bit higher risk for a fall. The rest on the checklist get 1 point. So I'll go through those as well. Sometimes I feel unsteady when I'm walking, and unsteadiness or needing support while walking can be a sign of poor balance. And we know that poor balance can lead to falls, which kind of goes along with number 2 is the next one. I steady myself by holding onto furniture when I'm walking at home, which is also a sign of poor balance if you're needing to use furniture while walking at home, or if your patients are, or your family members are. The next one on this list is, I need to push with my hands to stand up from a chair. And this is a sign of weak muscles or leg muscles. And this is a major reason for falling if you don't have strength in your legs. And a lot of the evidence-based programs that we have conducted throughout Texas work on leg strength to prevent falls. And I know Marcia will talk a little bit about that towards the end as well. And then the next one is, I have trouble stepping up onto a curb. If you answer yes for this, you're getting 1 point. And that is because this is also a sign of the muscle weakness. So again, a lot of the evidence-based programs that are available out there to prevent falls work on the leg strength and the balance, which are all those physical and mobility risks. And then the last one on this list is, I often have to rush to the toilet, and we put it on the physical risk and mobility, but then I kind of thought this might be able to be on the medication list as well. And we know that if you're having to rush to the toilet, especially in the middle of the night when maybe it's darker in the home or you had just woken up from a sleep, you might be more likely to fall in those situations. So that is definitely a risk. That's it for the physical risk. And Lauren, you can go to the next slide. Okay, so disease medication. And so the reason why I mentioned that the often having to rush to the toilet might be a risk is because we know that some medications or some disease can cause more frequent urination. So if that is a risk someone is having, it definitely can cause more falls, and you want to be mindful about that. Other items on this or in this category that we stuck in this category where I have lost some feeling in my feet. We know that neuropathy comes from chronic disease, can be from medications, sometimes maybe sitting too long as well. If you've lost feeling in your feet, may fall asleep, but this can definitely cause you to fall. The numbness in your feet can make you stumble. Stumbling can lead to falls. So want to be aware of the neuropathy. And then the next one is I take medications that sometimes make me feel lightheaded or more tired than usual. And as we all know, side effect or medications have many side effects, but this one, the lightheaded or the more tired side effect that a lot of medications have can increase your chance of falling. Obviously, if you stand up, don't exactly know where you are, we always suggest you sit back down and wait before you start walking to prevent falls. The next one, I take medication to help me sleep or improve my mood. This could probably also be on the mental and emotional one we talk about category as well. But here, these types of medications, when you take these, they can sometimes increase your chance of falling as well. Okay, you can go to the next slide, Lauren. Okay, and the last category here, we're talking about some of your mental and emotional risks. So we've talked about physical risks, we've talked about medication side effects risks, and there's also mental and emotional risk for falls. So these items on here are, I am worried about falling. If you're worried about falling, then you get a point for that, because people who are worried about falling are actually more likely to fall. We know the mental and emotional effects of just having that anxiety of fear about falling. And the last one here is I often feel sad or depressed. And symptoms such as depression or not feeling well, they sometimes make you feel slowed down, or you're not up and moving like you usually are. And those are often linked to falls as well. So I believe that completes the checklist. And you can kind of see, we put the scores here as we broke it up. So how you would get to a score to determine if you were at risk of falling. I believe it was the 4+ out of the possible 12 items that you would be at risk for falling if you scored that. Go to the next slide, Lauren. I'm not sure if I think it might be on to Marcia again. There you go. Marcia, do you want to go here?
Yes, and so I think when we looked at those falls risk factors, what you saw is many of them were related to physical functioning, mobility, strength, balance. And so we know that this is a major risk factor, not the only one. But if we're trying to think about the one thing that people can do to help themselves to prevent falls, it's really being as physically active as possible. Physical activity is a good way to counter risk of falls. But even though we know that it's important to be physically active, less than half of older adults are physically active. And part of the reason is that older adults, their caregivers, just don't know how to start an activity program, particularly for someone who may be a bit frail. So what we'd like to refer you to is the Easy For You Toolkit. This is something that a national group put together that goes along with screening, but what it basically does is it lets people know how to be physically active, both safely and how to go about it with, they also have sort of safety hints. So let's go to the next page and we'll show you this is the Easy For You. It's on our website, easyforyou.info. And it really is excellent. It's also being endorsed by the American College of Sports Medicine. It's what you do if you're not always in a medical care setting. In the past, it used to be you had to ask your doctor if you could be physically active. Now we really say you should be asking your doctor, your healthcare professional, why you shouldn't be physically active. So this thing lets you sort of know different, health conditions, no matter what your health condition, when do you see a doctor, how do you exercise if you have arthritis, how do you exercise if you have high blood pressure, if you have diabetes. There's no excuse almost to not exercise. So it tells you, it's an algorithm again, that tells you the kinds of things you can do, and it gives you resources. You don't have to ask your doctor if you can walk around the block and be physically active, but this isn't an either or. It's back what we said at the very beginning. It's the importance of linking community, home, and clinical settings. So it's good to talk to your healthcare provider and let them know what you're choosing to do, and to even share this toolkit with them. So that's the end of the toolkit. Let's go to the next page. STEADI really focused on those intrinsic characteristics, physical activity, mobility, medications, emotional health. But it's important to recognize that the environment can also either be a facilitator or a cause for falling. So there's another toolkit that we recommend you look at, and that's conducting home falls risk assessments in the same way you would do STEADI, to understand if there are hazards in the home. And on previous falls prevention days, we actually had set up a home-like environment where people could visualize the different hazards. But we all know it's important to look at the falls. You don't want falls that floors that might be slippery or having glare. It's important, if you have stairs, to be able to have railings on the stairs. It's important to look at the lighting so you reduce glare. And it's also important to make sure that those items you use commonly are reachable. A lot of falls do happen when people reach over, lose their balance, or we've all heard the story of people on ladders. So it's really important to look at the home and the community context when we're talking about falls prevention. So let's go to the next page, please. We are back to Matthew, and we thank Amy and Melissa for listening so intently. If there's any questions you have or comments, we would love to hear them.
Yeah, I definitely echo that. And thank you so much for that overview and that in-depth dive into the STEADI Toolkit, the easy for you, which is absolutely wonderful. No reason to stay out of activities and evidence-based programs if you don't have to. Just understand your risk and make sure that you can still be informed. And then, of course, assessing your environment. So yes, any of the folks on the call, is there anything else that we can talk about? Anything you want to raise? Anything that's in your setting, in your training that you'd like to go ahead and raise? Anything we can do?
I just wanted to make a note that I just put into the chat. The video that Dr. Ori was talking about earlier, showing the different falls hazards, I will have that up as a resource on the Falls Prevention Texas website, and we'll have that up on our YouTube channel as well under our falls resources. So please be sure to check for that later today.
Excellent. So we hope, this is the third day. There are 2 more days. Ashley, do you want to preview the next 2 days?
I will let Matthew do tomorrow, because tomorrow's actually a training that he is hosting with another state. So Matthew, if you want to talk a little bit about that one, I will let them know about Friday.
Yes. So tomorrow's activity is actually in conjunction with the state of Maryland, and is a national training on a program. It's a brief intervention called Stepping Up Your Nutrition. And Stepping Up Your Nutrition actually focuses on malnutrition, whether it's protein, hydration, etc., because malnutrition is a very large and leading cause of falls. So this can be used as a session 0 for any other evidence-based program, but it can also just be used on one-on-one interactions with older adults, or just using those skills in every interaction with older adults. So that training is on a webinar that starts tomorrow at noon our time. So an hour later than today's events, it starts at noon.
Excellent. And so then day 5, Ashley, and then we'll go to the question. Matthew, you might want to look at the question because you're going to be the best person to respond. Ashley, day 5.
Sure. Day 5, we have a panel of a couple of women that are highly involved in some community organizations. And the title of the slide is Connecting the Community to Prevent Falls. So we have someone from Tarrant County, someone from Travis County, and then someone who's representing Harris County that will be on that call talking about what they're doing in the community. And it's talking about community-based organizations that are committed to providing falls prevention programs and services to all older Texans. A really passionate group of women that work hard to do this across the state. So it'll be a great presentation on Friday as well.
Thank you. So Matthew, can you address the question in the chat?
Oh, absolutely. So there's a great question about, in a hospital system, where is the best place to use the STEADI Toolkit, and in which profession once the patient is stabilized? And I think that last part is really important. When an individual is having trauma, when they're in traction, it's probably the wrong time to kick this off. But to be able to gather that information and determine whether falls or a falls risk was associated with whatever presented them there is very important. But it's not the time to kick off a toolkit, especially around some questions. With that said, I believe I referenced earlier, the thing about the toolkit is that it's not really intended for one individual. It's actually to try to create a climate, a culture of fall prevention in any setting. So there are elements in the toolkit for all individuals, whether it be the physicians, the nurses, intake, whether it be the PAs, the MAs, or any of the allied health sciences as well, the PTs, OTs, everybody else. With that said, I think whoever has direct contact with the patient is really the one who can kick off the process. It might not be in a formal medical examination setting. It might just be during intake while collecting vitals. There's a lot of different ways that this can be done, where you're asking these kinds of questions to better start to understand what are their falls risks, what is their falls history, and are they limiting their activities for any of these reasons? So those are all great opportunities. The question really becomes, how do you document that information so that the next individual, if the nurse takes them from there or the clinician, physician sees them thereafter, that they know this information and they can start to do the next steps on the algorithm. So oftentimes what it comes down to is there's no wrong profession, no wrong opportunity to start the process by asking the questions, engaging the risk. But the setting itself has to think about the algorithm in and of itself to know that after that kicks off, who goes next? What is the chain of custody, so to speak, of who gets to see them next and take it to that next step, whether it be for the functional assessments or any of the other types of referrals.
Excellent. Did that help answer your question? And I assume it was Amy.
That was Melissa.
Oh, Melissa. Okay.
Perfect. Oh, and give an example of hospital policies to keep people safe from falls.
The traditional hospital policies, I think, were having bed rails, because we know a lot of people fall out of their beds. So that was like a traditional one. Now we have a friend who's in tech, where they basically use technology so that you can detect when a fall occurs, and then the message goes out to the reception area in like ER or in a hospital setting, so somebody knows immediately. And I think particularly with COVID, there are not as many checks as there used to be. So the issue is, how can you make sure that if there's a fall, it's detected quickly? another kind of policy in long-term care facilities. It's mandated even in assisted living facilities. If there's a fall, it has to be documented. I think in the past, people fell and it was never documented. So it's that documentation, it's telling the families, it's making sure if there's injury that people get into appropriate treatment.
I also think there's new innovations in rounding so that there are certain elements of fall-related risk that can be assessed more frequently. Oftentimes, like Marcia was saying, when individuals might fall out of the bed, or if they need to use the restroom, or if they're on medications, that unfortunately, if they haven't interacted with somebody, they might just go ahead and go. And so while they're not being restricted, while those technologies are wonderful to observe and maybe report if it does occur, certain practices in rounding, especially based on the conditions, the medications given, are starting to take more notice of falls because they are so detrimental to the patient health and costly.
Right. Any other questions for us? It's been a pleasure to be able to talk with you today.
Yeah, that's a great point, Ashley. It's not just about the patient, definitely about the families too, caregivers and everyone.
Exactly.
Well, this is wonderful. I want to go ahead and say thank you because today is actually the first day of fall. So it is National Fall Prevention Awareness Day. Today is the day. It's
I don't know. Yeah. I don't know about where you guys are, but I think the weather man got the memo too, or the weather did, because it's nice and cool here today. So hopefully you guys are enjoying that as well. Right on cue.
Right. Well, thank you again. And if you want to hear about the other sessions, if you didn't, Lauren, can you repeat again where we can find all the sessions?
Will be up on fallspreventiontexas.org on our resources page, and I will have a link to our YouTube videos. They take a little bit to render, so give me a couple of days to get them up, but they should all be up and ready next week.
Thank you so much.